Colleagues, this is not a simple bill, and this is a direct rollback of a place we went in the last legislative cycle. House Bill 4164 passed during the 2012 session on a 55-5 vote here and a 26-4 vote in the Senate. That bill gave school districts the opportunity to opt into the exchange. In addition, a great deal of discussion was given to the federal waiver, which would allow groups larger than 100 to get in specifically so that we could give school districts the option of being competitively bid through the exchange. The intent behind the current ORS language was simple, really simple. Allow school districts greater flexibility and choice in choosing health insurance plans, and in turn, providers. Most of us like to talk about how expensive health insurance is. We all like to talk about how little money school districts have. House Bill 4164 gave us an opportunity to give those districts a conversation about both. A double win. The previous legislative process took a step in the right direction and said, let's allow districts to look into the exchange. And here we are talking about taking a major step backwards. By giving OEBB the ability as a provider to veto plans, this language in this current bill has the effect of the fox guarding the hen house. They would be one of the only listed providers who provide plans who had to be negotiated with and whose price had to be exactly the same inside or outside of the exchange. Where's the competitive bid in that? In fact, where's the competitive spirit in that? If what you say is you must agree on the same price in as out. We're not just talking about somebody who deals with health insurance plans. I believe, contrary to the carrier's comments, we are talking about a provider. We're talking about making a change to a legislative bill about a process which hasn't even fully started yet. Why are we changing before we've given it an opportunity to prove itself? Convince me there is a reason that something's wrong so far. We moved this legislation to give those school districts the opportunity to opt into a competitive market. Did it work? We don't know because it hasn't been implemented. And yet we're willing to step forward and change already and give one carrier that competitive advantage. No other provider has that advantage. We wouldn't stand here and argue that any other provider should have a guaranteed rate inside or outside of the exchange. We wouldn't say to any other provider, hey, you guys insure all the realtors, so you get all your prices the same. You insure all the fuel dealers, you get your prices the same. But for some reason, we're going to say to this group, you do school districts, so we're going to let you have identical pricing inside or outside the exchange. And we're going to let you do the agreement. Colleagues, if you were here during this last legislative session and you took the vote to move forward on a plan to save your school district's money, I look forward to you seeing that there is not necessary to back away from what we've done. I look forward to you holding your word. I look forward to you walking the walk. Give your school districts some much-needed flexibility to cut their rapidly rising health care costs and bid into an open market system. Please vote no on House Bill 2128.